Good morning, afternoon, and evening, and welcome to the SpunkGo webinar. Today's speaker is Dr. Fatima Zehra. Fatima is the chairperson at the Jinnah University for Women in the Department of Physical Therapy. It is my greatest pleasure to welcome Fatima to talk about the role of nutrition in physical therapy. Just a side note, Q&A will be done through the chat feature after her presentation. SpunkGo is an all-girls global student organization where proceeds go to charity. And with that, the floor is now yours, Fatima.
Thank you so much. Assalamu alaikum. My name is Dr. Fatima Zehra. I'm a physical therapist, currently practicing my cardiopulmonary rehabilitation. Along with that, I'm also running the Department of Physical Therapy at Jinnah University for Women. It's an all-women university located in Karachi. One of the very first, one of the very first universities that were ever established in Pakistan right after the independence. So it caters to women only, and we focus on women education. And right now, I am the chairperson of the physical therapy department, which is running since like the last year. And we are just trying to enroll as much as we can in the medical field, especially the role of physical therapy and what is physical therapy and everything. We are inducting students, especially females, and promoting their health as well as education. So both of these things are working together. Combined, we are working on that aspect. So that is my brief and minor introduction. I have done my cardiopulmonary rehabilitation MPhil from Ziauddin University. It's and that is what basically my research is all about. I have been focused on mostly researches that are towards the nutritional aspects of physical therapy, because from my undergraduate thesis to my final year thesis in MPhil, I have been trying to sort of integrate these two things. What is the nutritional aspect? What should we do and what should not be done during a session, and what should be the follow-ups, what wholly the meals, and what is the nutritional value during exercises, what are the demands of the body, how are we supposed to fulfill those demands, what is good nutrition, what is poor nutrition, and how do we focus that when we are in under a regimen of under we are working with the physical therapist for recovery, or even if we are just trying to be primarily supportive. So all of these things come has been what my topic was about today: physical therapy and nutrition. So basically, to understand the value of nutrition, we in physical therapy, we have to know what physical therapy is all about. So physical therapy or physical therapist deals with from evaluation to recovery. Like if you have an injury, or if you are injured in any way, or if you have if you are just working on your physical health, like you want to get better. For example, we are using these Fitbits these days that counts a step, and we are trying to work towards a better living life, to prolong a life, or to make the life that we have better. So physical therapy deals with these situations, deals with these aspects of your life. The therapist is supposed to be your guide, be your evaluator, be your assessor, to make a path for you, to make a prescription plan or a physiotherapy program or an exercise program that will lead you towards a better living, that will enhance the quality of life that you are currently in hold of, and it will make it better. We call these enhancing activities of daily living. Like if you are living in a facility which is on a, if you are living on a flat facility and you are on the third floor of the building, so this is very necessary that you should know that whenever you are going to as you will age, or whenever you are going to go into decline state, health state wise, you're going to need to get back to that third floor building, back to that living life, back to that daily routine. um, a physical therapist will prolong that, will facilitate that journey, so that you can elongate your procedures. I mean, we are associated with all the physical aspects of everything, from exercise to pain management. If you are injured, we will work on the pain management aspect. If you are not injured, if you are just, trying to get better if with your physical health, then we will be like a trainer. We will guide you. We will plan your whole recovery, or whatever your goal is, that you will present to your therapist, that this is my goal, I'm supposed to be doing this. So if you come with that aspect, we will help you with that. If you come with an injury, we will help you with that. A physical therapist is supposed to provide you with rehabilitation services. Rehabilitation is a big umbrella, especially physical rehabilitation. We work along with a lot of other therapies as well. A rehabilitation process includes your recovery from bed to standing, or standing or walking, or whatever the situation was. For example, in COVID times, we have seen patients who were on ventilator, and a physical therapist was supposed to be the facilitator on that aspect. He was supposed to facilitate his breathing activities when he was unconscious, and when later on they get better, they start to get better, we were responsible for making sure that they get out of the bed, then they get mobilized, like they are able to walk again after this particular incident, and then they get better enough to get back to what they were doing before. So these are all the things that a rehabilitation process includes, from bed to standing or walking or going back to work. That is what the rehabilitation process includes. So this process includes a physical therapist. We also work with along with an occupational therapist. They work along with us in providing motor tasks, especially the physical therapist is supposed to be focused on gross motor functions. They're supposed to make sure that the patient's standing, that the patient is active, that the patient is able to walk. An occupational therapist, he works with us to make sure that he's able to get back to work, he's able to hold the pen again, he's able to pull his hair again, he is able to be independent, he or she is able to be independent. So that's what an occupational therapist does with us. Along with that, we have a psychologist or a clinical psychotherapist who works with us to make sure that this, after the physical aspect, the mental health is not getting a barrier. For example, some people have who has an injury due to fall, gets developed they develop a fear of falling again. So what happens is, when we are giving them supported sitting, they are very good with us. They are supportive. They with support they're able to walk. But as soon as we take that crunch, the dependence away, they start to fall again. So that fear of fall remains in the patient, and we work with the psychologist and the clinical therapist. So to make sure that the physical barrier and the psychological barriers are also matlab, they work together. They work together so that there are no barriers. The patient feels that he is able to, he is able to achieve, and he's willing to increase his power. He's willing to increase his mental capacity so that he can go and do the normal tasks, the normal activities he was doing before the injury. So that is what clinical psychotherapists do with physical therapy, along with physical therapy for a rehabilitation process. We also include in our regimen a nutritionist who works with us and provides with the proper nourishment that a body needs during these times when we are sick, or we have some injury, or we are bedbound, we are not moving at all, an unconscious patient, or a patient comes in with any sort of sports injury. So we have to make sure that he's taking, or she's taking enough nutrition, or he's nourishing his or her body enough, so that they are able to provide that strength, so that we can we can make sure that we can implement maximum amount of exercises, even as much even as little as having proper water intake. It depends solely on how much water a patient is taking. So then we are able to implement exercises, especially in a cardiopulmonary rehabilitation department, when the patient is coming to us with, procedures such as bypass surgeries. They have coronary artery bypass grafts and some sort of procedures that includes the heart. So we make sure that the patient has enough water intake, because when he will start sweating, his blood pressure will start raising. He needs to have that water to make the blood run thinner. So that in this, just the intake of water is what a good nutritionist or good therapist will implement, so that the patient or the person who, the client or the patient, whatever he or she is able to implement most of these things in his routine. And physical therapist is supposed to a physical therapist is supposed to be a teacher, a guide, basically, because we are not only just focused mostly on the process of the time that the patient is with us. We are actually training the patient to get better, to get better living, to get better at living. Whatever the procedures of his living are. If he is a bodybuilder, if he is you know, a watchman, a guard, if he is supposed to stand for 12 hours straight, we are just going to tell him how to stand better. This is what we do. This is what we will be doing. So along with that, we will implement this nutritional aspect. We will be guiding them. If you have, you know, brittle bones, if you have osteoporosis, especially in females, we will be guiding them to take calcium. We will be telling them to increase their vitamin D intake. We will be guiding them what to achieve the maximum amount, to achieve the maximum they can achieve with their bodies. In the nutritional aspects, we can see we have good nutrition, we have poor nutrition. Um, Anywhere wherever we are, wherever we are living in the whole world, we have two types of diets. We have one diet that we all know that is good for us, and there's a diet that we all want to eat, that we all physically and mentally are ready, that this is something that I want to eat. I know it's bad for me, but we will go towards that diet more often than not. Like in 7 days a week, if you are not a very healthy person, healthy in the aspect that you don't focus on your health enough, so you will be like 4 days a week, I'll have a burger, I'll have a sandwich, I'll have white breads, I'll have pastas and everything. And one day a week, you will just focus on, okay, now this is the day I'll have a salad. So this is what the difference is between a good nutrition and poor nutrition. A good nutrition is supposed to be well balanced. It's a diet that composes of fibers, nutrition, you know, all the good things, and basically low on carbohydrates, because those are the sugars, those are the and fats, those are the bad things that go into our body, and they start to destroy each in every cells and all the metabolic activities. So good nutrition is an advocate well balanced diet, which should be combined with a proper amount of physical activity, so that you are considered a good and healthy person. If you are not, if you're not taking a good nutritional value, and you have this particular amount of time that you go, okay, see, I'll walk for 10,000 steps for today, or I'll have 12,000 steps today, and then you don't have good nutrition, so you have poor nutrition, that will lead to decreased activity rates, decreased, increased risks of injury, increased risk of mental issues, increased risk of physical problems, all of these things, that especially your productivity will be reduced. And whenever we eat something that we know that's bad for our body, this happens, our mental state goes down. We do know that this is something that we are putting in our body that is going to be harmful. Later on in life, we're not going to be able to, later on in life, is a very big thing. We will not be able to sit with a full stomach full of hamburger. You will not be able to sit comfortably after eating that. You just put something that is not good for you, and you'll be uncomfortable. You'll be mentally digressing yourself that I should not have had that. I know that's not good for me. I should not have had that. If you are not concerned about that, that is an even bigger issue, because you should always be cautious about what you're putting inside your body, because that is going to stay for a long time, and it is going to affect your immunity. If it is going to affect your, susceptibility to disease, the ability to catch something. Like if you are eating bad food regularly, you must know that the chances of getting food poisoning is very, very, food poisoning is very common. The chances of you having a slow metabolic rate is very common. The chances of your, having developing stomach issues, ulcers, and H. pylori, all of these things, they do come together when you start focusing on poor nutrition. All of these things, if you are not having a balanced diet, if you are not combining it with regular activities, all of these things will ultimately lead to reduced productivity. And wherever you work, whether you are a student, you are in a staff, you work in a hospital, you are a medical doctor, whatever you do, regardless of that, whenever you are having something bad inside your body and you're not com- comparing it with a good physical regimen, you are ultimately going to have reduced productivity. You are going to mentally be very unsatisfied because your tasks will not be completed on time. You will be less focused. You will have a proper, you will not be able to have a proper routine because nutrition affects your overall health. Your digestion is impacted. If you are having something heavy, it will be delayed digestion. If you're having something healthy, you will have a particular routine in your physical activity, in your everyday living. You will know when you are going to do you when your stomach is going to be emptied, with what your metabolic rate is at. If you are not eating at home and you're not having a balanced diet, you will be able to tell that, okay, I had this food like at 6 o'clock and it's 12 now, and I have a heartburn because of that. Now I will not be able to sleep until this heartburn recedes, and when it recedes I will be able to sleep. So that time that you spent in pain will be all because of poor nutrition, and that will lead to the next day, because you will not be able to focus on work, you will not be able to focus on your studies, and ultimately what will combine it will combine and your physical, mental, every health aspect you have is going to reduce your productivity. What does a physical therapy or physical therapist do? What is the role of physical therapy in nutrition? So the role of physical therapist is to improve and promote wellness. That's what I've been focused. Generally, whatever our health is, we have to improve. We have to always go for better. If you are running you're running 2 miles today, you will strive to get better. You will be like, okay, 2 miles today, I'll do three tomorrow, I'll do four, after that five. You want to get better, you want to get better at everything. So that is what a physical therapist does. He promotes wellness. He or she will implement changes in your daily living. He or she will be like, okay, you should do this with your aspect. If you are, you're not running, he will say, okay, start walking. If you are walking, what will be the small step? It will be starting with, okay, you just do 5,000 steps a day. Start with that. That is your goal. When you start establishing small goals, especially when you start with exercise activities, and you tell the patients that if you do this with your life, if you manage or if you change your lifestyle like this, you will be able to live longer, or if live better, and you will not need these many medications. You will not have to have so many pharmacological interventions inside your body. The patient will be receptive. The patient will be like, okay, fine. Smaller goals are always better. It will be like, okay, I'll do the 5,000 steps, then I'll do the 2,000 steps, then I'll do 2,000 more and more. And finally, you will be able to reach a point where you'll be like, okay, you have to do this many exercises, you have to do this many activities, and you'll have to eat this for you to have a lifestyle that is very better. You will be able to have a good health setup. You will have you will be able to see the improved outcomes. What you are practicing, what you are putting in your body, what you are forcing your body to do, all of these things will work together, and the patient will be able to tell the difference, what he was before and what he is after the treatment. They will the or after the follow-ups, in between the follow-ups, the patient will be able to tell, and he will be like, okay, fine, this is something that I got through this treatment, through this regimen, by following the advice of physical therapist, working with him or her to achieve this level of quality in my life. So that is what the role of physical therapist is to improve and promote wellness in overall general health, lifestyle, and quality of life. We try to manage lifestyle related conditions, especially as we age. There are certain things, of course, as we age, regeneration, generation occurs, that keep happening. They will not stop. Your skin will turn wrinkly and dry. You will get knee pains, and you will get shoulder pains, and you will get cervical issues. Your head will, you will feel the age. But what we can do as therapists, and what we can do, um, working with working with a therapist, or working in conjunction with a physical activity, promoting a physical activity, is we can delay the effects that will have on a body and manage these issues. We can just, if a person develops osteoarthritis at age 38 right now, or age 35 plus, that is an issue that we are facing, because vitamin D deficiency and calcium deficiencies, these are producing these results. These are because of low sedentary lifestyle. We can manage these issues. We can ask a 35-year-old to please get out of your seat more. If you are on an IT job, and if you are on your computer a lot, please change your posture more often. If you are not going on walks often, we can ask them, just take a 5 to 10 minutes break in between your work, and just walk around your office, and then come back, sit on your seat, resume your work. You can implement these changes. These are very small changes that will affect you on the long term. You will not be susceptible to these diseases. These are actually disorders and diseases that will affect your life, that will affect your activities, that will affect your early signs and symptoms of all the bad heart issues, and bone issues, and back pains. All of these things, they are all because we are not implementing a balanced lifestyle. We don't have good nutrition. We don't have good healthy physical activity balance. When we don't have a balance in our life, everything starts to crumble. So the physical therapists, they are in that position that they are able to implement these changes in your life, and they can establish a whole, you know um, what you can call it we will call it a prescription plan for the patient to follow, that these are the activities that you're supposed to follow throughout the day. That's why I kept saying physical therapy doesn't just end with a session. We don't just have a 45-minute session or 30-minute session with the patient, and then we're like, okay, fine, whatever he does at home, it doesn't affect us. Or we don't have that particular pain management prescription where we're like, okay, at 9 a.m. in the morning, you're supposed to take this pill, you'll get better. At 3 p.m. after dinner, after lunch, you're supposed to have this. After 8, you are supposed to have this, and you will get better. That is a pharmacological intervention. Those, of course, are very important, but we don't go like that. We have a particular um, mode. We have to implement behavioral changes to improve their general health. We have to make them realize that their lifestyle has to be changed. They have to implement all these changes so that their outcomes can be measured. We can see what these minute changes and minor changes affect them, how they affect them. So that is the role of physical therapy in nutrition. Of course, there are benefits to, if we have a balanced physical activity and nutrition, we start living a healthy life, which includes good nutrition, which will consist of adequate, well balanced diet with regular exercises. Regular exercises need to be like 7 days a week. You're doing cardio and you're going to the gym and you're running on the cycle. That doesn't need to happen. What you need for balanced regular exercise activity is a particular amount, like just 5 days a week. You go on a walk, a long walk, or then you start, that walk becomes a power walk, and you increase your speed, and then you add some physical exercises to that, so that your muscles are getting better. You start gaining power and strength in your muscles. That's all of regular physical activity should include. Nutrition, of course, is a very crucial component of rehabilitation. It helps people to get better, and especially if you are recovering from an illness, or if you are ill, or and if you have some sort of sickness, nutrition has to be properly maintained throughout, so that the patient is able to stand. You cannot force a weak patient, or a weak person, or a sick person to just stand up and start walking and doing physical activity, because that's not something he's able to do. We have to make sure that we are providing him with enough background, enough nutrition, so that that aspect is completed. So after that, we can be like, okay, now that you have eaten your meal, it's been 2 hours, you look well enough, your color is good, can you try to get out of bed? And if you is only able to get out of bed, that's okay. That's the physical activity for today. You're already sick, that's okay. But if he's able to get out of bed, we'll be asking the patient, okay, are you able to stand up? If he's able to stand up, we'll be like, okay, now are you able to walk? If he just takes 2 steps, that's an achievement. The next day, we'll work on 4 steps, we'll work on 10 steps. We'll increase the physical activity and we'll increase the patient's tolerance. We'll improve overall health, we'll improve his physical well being. And that will ultimately, in a normal patient, in a normal client, be the reduction of any sort of diseases, especially reducing chronic diseases, especially the chronic diseases that are osteoarthritis, cervical spondylosis, back pain issues, lumbar pain, all of these things, hip pain. These things we will be able to reduce. The challenges that we feel that restricts the physical activity and the knowledge that is supposed to that should be given out to all the patients and clients is that they don't feel the need to become better or to focus more on their physical activity or health until unless they have a problem. We have two categories of people that we interact with. We have patients and we have clients. Patients are those that are already sick, that have a particular sickness and any sort of illness, some sort of disease, some sort of chronic disorder. They will come to us. They will come for a session of physical therapy. They will come seek a therapist because they need that pain relief or they need that physical activity, particular physical activity that has been lost to them to get back to their living. But when we are talking about the clients, the second people that we deal with, clients are normal people that don't have any particular issues, that are fine right now, but they may get better with, they may prosper, they may get benefit from physical therapy, but they don't because they have lack of information. These are the challenges we have. No young person has this knowledge or information that a physical therapist a 1 hour session with a physical therapist can be just for guidance. You will only be assessed and we will let you know that these are the things that you're doing wrong in your daily life, that if you do it better, you will not be coming to us as a patient in 10 years. This is the lack of information that we feel as a challenge, because challenge will that information will make them better. When a patient is working on a computer with a hunched posture, forward head, and he's continuously working for 10 to 12 hours a day, he or she will develop some sort of cervical issue. He or she will have some sort of radiculopathy, radiating pain. Maybe not now, but in a 2 year time, he or she will start getting these kind of problems. The cachexia or the loss of muscular activity, the loss of muscle power will start happening because you are literally forcing your muscles to be in one position for a long period of time. That is going to be problematic. That is going to create a problem which is going to be solved later on as when you become a patient. You will come to us ultimately, but it's better to prevent these things by information, by guiding the patient before we have to, go towards any drastic measures. So many total knee replacements can be reduced if the patient just comes to a physical therapist at an early age, just to get that 1 hour knowledge session where we just tell them that these are the exercises that you need to do, and these are the supplements or the things that you are going to take or eat, which is going to help you get better. So these are the things that these are the challenges that we have. We have lack of information, which ultimately leads to some sort of muscle mass problem, muscular issue, and the patient the patient will start self-medicating with artificial nutrition options, protein shakes, and having those capsules with vitamin D and C and all those extra stuff that they don't need. If they have good nutrition they have good nutrition and normal diet, they'll start having that so that they can get better. But this will not help. These will be the things that is going to make them a patient, and then they will come to us with a particular issue, any sort of issues. The role of physical therapy in nutrition plays a pivotal role in the healing process, especially when I'm talking about a patient. They can be any sort of issues. We can have a musculoskeletal injury, we can have a cardiac injury, we can have any sort of problem. And if they are not properly nourished, if they don't have proper nutrition, we will not be able to in the end heal them properly. If a patient is coming to us with some sort of musculoskeletal injury, and their muscles are stiff, or their muscles are tight, and we are not able to get them mobile again, they're fixed, so we will know that the muscles are dehydrated, the bones are dehydrated. We will need the patient to have this particular amount of nutrition value, a particular amount of calcium, particular amount of water in their daily living, so that we can have that baseline. Okay, this is his nutritional value. Now we will be able to implement more exercises. So while not in the scope of physical therapy to practice and design nutrition plans, these we are not supposed to tell the patient what his intake should be, the amount of carbs he's supposed to take, the amount of proteins he's supposed to take. We can influence them, we can guide them, we can sort of make him know that this is the baseline knowledge, that all the nutritional aspects should be completed for you to get better, to heal better. So that can be our role. We can we can tell them, let them know that this is the nutrition that you need to get better, and they will listen to us. And or we can just guide them towards nutritionists and tell them that go to that nutritional plan, follow that particular things, and you will be able to have a better living. Or you can just during the session let the patient know that, okay, if you have vitamin C deficiency, you can have this much amount of oranges, and you will start getting better, you will start feeling better. That contact with the patient, that mostly to the relationship we have with the therapist and the patient, that encourages them mostly to get better and to start getting a better recovery process. Okay, so the role of nutrition according to APTA. APTA is an association of physical therapy, American Association of Physical Therapy, and they have a particular, they have guided us particularly that these are the things that you're supposed to tell the patient, and you are supposed to let the patient know. So they say that the diet and nutrition are key components of many conditions managed by physical therapists, and nutrition can directly affect recovery, especially sports recovery and functions, while an individual is under physical therapist care. PTs should be concerned with and address nutrition intake and eating patterns of their patients and clients. They should know what they are doing. They should have a particular idea of the diet that the patient is under. If the patient is following some sort of a plan already, that we should know that. If the patient is on low calorie diet, or if the patient is on low carbohydrates diet, the therapist should know that, because then he will be able to monitor any sort of irregularities that he might find during the session. The American Physical Therapy Association supports collaboration at the association and membership levels to promote education, research, and practice between physical therapists and registered dietitians to promote the health and well-being of society, consistent with APTA's vision and guiding principle to achieve that vision. They have told us that we have been working with nutritionists throughout our careers, who will promote particular amount of things that will help in diet, especially if you are injured. They will say, okay, vitamin C, they need more platelets, make them eat this, and different aspects as well. So we work with nutritionists. We work to sort of plan and execute good nutrition with the physical aspect. Whenever a patient comes to us, there are like 3 stages in which the patient is when we are treating him. We have inflammatory phase, which is the phase where the injury has just occurred, 24 hours. Acute after the acute phase, like after the injury has just occurred, you get the healing phase. So in this inflammatory phase, the goal is to control the inflammation and prevent any sort of excess inflammation. Inflammation is the swelling. Whenever, like if you twist your leg and your legs get big, that swelling is inflammation. So whenever you have inflammation, you are supposed to be like, okay, this is going to need these things. You know, we have to combat inflammation. We have to get good nutrition into the patient. What are the dietary things that are going to need? We are going to need fats, dietary fats. Which dietary fat? We're going to need omega 3. We are going to have to be like, okay, the patient needs omega 3 to combat this inflammatory phase. This is what the role will be. The therapist will guide the patient. Okay, you are doing pain management, you are putting a cold pack on your leg, you are doing minor exercises, but you need to have this much amount of omega 3 so that you get better earlier, or you get advantage from that. If you don't have omega 3 in your body, if you don't have that particular fat acid, that you don't have essential fatty acids, your recovery will be compromised. So in this is what we just tell the patient, that because to combat inflammation, patients should increase the consumption of essential fatty acids, especially omega 3. Omega 3 is known as an essential fatty acid because the body cannot make it. Because we cannot produce it ourselves, we need to have it through food. So some foods that are used in remedies as well. The foods include for muscle soreness and recovery. This is just a list of some eggs and watermelons and nuts. And these are the things that you can have when you are in the inflammatory phase, when you're going to the therapist. Fruits and vegetables will also aid in controlling the inflammatory process because they are rich in antioxidants. Antioxidants, of course, we all know that they are very important for your body. They help in containing all these things. They help in his inflammatory process. They improve the process so that you can get better earlier, you can get better faster. So what are the examples or some things that you can do to facilitate your inflammatory phase? You can have broccoli. It contains sulforaphane and it may help your cartilage. If you have cartilage breakdown, it will help with that. Citrus fruit, which contains vitamin C, as I said, it supports collagen and protoglycan synthesis. So if you have some sort of injury with the, you are, you start having citrus food, it will help. Red grapes, they contain resveratrol, which suppresses the pro-inflammatory cytokines. So this will help you when you are in your inflammatory phases. Additional inflammatory mediators include turmeric and garlic, which patient can add as dietary supplements. This will be the dietary supplement that will be in the background, and the physical therapist will work on the physical aspect. They will try to get the inflammation down, they will try to get the pain down, they will try to make sure that you are mobile again. During the recovery of any injury, especially in the later phases, physical therapist, we all do well that the patient will experience muscle disuse and atrophy. Okay, we are not working with that particular ailment. Wherever the injury occurs, we isolate that thing, we stop using that particular area. We say, okay, this is that part of the body that is injured, we are going to take special care of it. We start losing their muscle power, we start disusing that particular muscle, which ultimately leads to some sort of atrophy in the muscles. These muscular activities should be increased by the therapist through physical therapy, and by the nutritionist through nutritional therapy. So all of these things will work together to provide a good, to prevent an atrophy and promote good tissue repair so that the patient can get better and return to its normal living. Role of nutrition physical therapy, gaining knowledge, especially very important that you should be aware of what you are inhaling or intaking and what that particular thing will do for your body, especially with the knowledge that some of the examples that I've given. And in the future, like nowadays, we are all mostly basically focused on all the cures that are coming in. We're not focused on all the cures that are coming into the pharmacological industries. We are going towards prevention. All the doctors are no longer treating just your disease. They are preventing you from getting that disease. So that primary level of prevention is very important. And that is what Thomas Edison said, that the doctor of the future will no longer treat the human frame with drugs, but rather cure and prevent disease with nutrition. So, along with nutrition, add physical activity, add physical influences, add some sort of, you know, action in your life, and you will be able to uh, be better. Your life, you will have a healthy life. You will have a well-being that is going to help with your productivity. That will initiate you to get better in your, daily life. These are some researches that are being done. For example, diet such as a cup of orange juice increases vasodilation, or beet juice, which are rich in nitrates, and they significantly reduce hypertension. Hypertension is blood pressure increased, or a nitrate green rich diets. So these are the things that you need to focus on. These are the things that you need to research on to, get better. And these are the things that your therapist will let you know when you are going to them. How sugar is bad for you, how carbohydrates are bad for you. These are the things that will be problematic. Okay, so that's it from me. These are the references. If anyone of you wants to know anything from whatever I was saying, if you need some sort of, reference from that, these are the references.
Thank you so much, Fatima, for that great presentation. I think that physical therapy is obviously just a very important job. And so when we're bringing nutrition into it, it makes it even better. So we have a few questions here from the audience that they would like you to answer.
Sure.
So the first question is, how do you describe the responsibilities of a physiotherapist?
Okay, a physiotherapist is supposed to be along for the journey. If you are a patient, if you are admitted in a hospital, or if you have some sort of injury and you go complain it to the doctor, a physical therapist is supposed to guide you throughout the process and help you through exercises, physical activity, and pain management therapies. We have some management techniques there where we can help the patient get better. And as a client, if you want to have a better living, better lifestyle, you will go to a therapist so that they can motivate you to do better. They can guide you so you can, you're able to have a good lifestyle. These are the responsibilities. We are focused mainly on increasing the physical activity, increasing the activities of daily living, making them better, and increasing your productivity.
I agree completely. It's like a person that will help you and motivates you to get better.
Yes, exactly.
Our next question here is, how do we explain people being underweight? Is there a correlation between being unhealthy and being underweight, or is this a very normal thing?
Depends on the level of nutrition the patient is having, especially if you are in a job where you are, your physical activity is a lot, and compared to that you're not having enough good nutrition, because metabolic rate is the main criteria, or the main reason the patient is not able to gain weight. If you have a very good metabolic rate, you will not be able to sustain that fat in your body. Your body will get it, get used to it, and get, whenever it comes into your body, that it will be converted into energy and you will be producing it. You will just, do a task with that particular calorie. But if you have a low metabolic rate, your body will have the susceptibility to keep that energy, make it into fat, lipid, fatty acids, and that will be in storage for a long time. This doesn't necessarily mean that a patient is having a lot of food so that he's fat, and this doesn't necessarily mean that a patient is starving itself to get skinny genes. These both things do not work in the same way. But a patient who is malnourished, who will let you know that they are not having enough food, be one meal a day or something like that, that is problematic. That is going to be problematic for them, because they will not be able to do normal daily tasks for a long time. Their muscles will start, wasting, and they will have low energy. Their caloric intake will be not enough. So if you are having your calories, the 1500 calories per day diet and normal physical activity, you are a healthy person. Does not mean you are overweight or underweight. It just means that this is what your body will be. That's why we have BMIs, body mass index, that will let you know that, okay, you are in this category. You need to do this better so that, you can get better. Doesn't mean necessarily mean that if you're a 5 inch, 5'4" person and 5'4" person, you should have a 54, 55 kg weight. That doesn't necessarily mean that.
I definitely agree with that. It's definitely a difference between malnourished and underweight, and there's
Exactly.
significant factors that can tell those apart. Mhm.
Exactly. That's
The
what it
next
is.
question we have here is, according to nutrition, what can you feed yourself in order to delay periods? I don't know if this is healthy or not, but yeah.
No, firstly, it is not healthy. These are something that should occur regularly. I mean, there are things that will help you regulate the cycle, but if you are totally like, I should stop it or delay it, that's not healthy. And I don't personally know anything that can stop or prevent that.
Yeah, it's a natural process and it will
It's a
happen.
natural process. Exactly.
The next question here is, how do nutritional needs change over time?
They change with age. They change with the activity that you're performing in that week. Especially, for example, I have a marathon coming up. For example, I have to run 10 miles or 20 miles. I have i should have that proper nutrition for that week because I'm training for a marathon. But if it's normal weight, there's no season especially that, you can take an example from sports athletes. In their off season, they are not on diet. They're not on a particular amount of diet. They have a relaxed diet plan. They have a relaxed physical activity regimen, that they're like, okay, this is the particular amount of things that you should be doing. You should not be relaxed, and you should not be relaxed as in you are just, destroying your body, or you are destroying the training that you had. But this is not, this is your off season. You're supposed to take it easy. But as soon as they are in the season, they are enrolled, their summer comes, and their games are approaching, the games start approaching, they're enrolled in training camps. Their training camps will have nutrition. This is the amount of nutrition you need. This is the amount of protein that you have. You will be push We start pushing the sportsman. We start them on diets and physical activities that will help them in the matches. So this is how your body changes. The need that you have for that particular week or for that particular lifestyle is going to be what you will be eating. When you are younger, you will be relaxed with your diet. When you get older, especially if you get any sort of chronic disease, if you are diabetic, if you are hypertensive, your needs will change. You will be, off sugars, you will be off salt, because that's what your doctor said, because that's what is, essentially killing you. So that's how your nutrition changes with age.
Okay. The next question here we have is it safe to take multivitamins, and what are some substances that a person can use without consultation?
Multivitamins is something that you can, of course, buy and have over the counter. But instead, if you are a young person, instead of having some sort of supplementary things in your body, protein shakes and multivitamin tablets, it's much easier to buy fresh produce, buy fresh fruits, and have that instead, because that will be, more beneficial, more tasty as well. So go for that options. Supplements are for, um, patients and people who are sick, who are in the hospital, who cannot, people with no teeth, who cannot chew their food. These are the things that should be resorted to the last, at the very last level. Firstly, you should focus on a balanced diet, so that you start developing these, to develop a good relation with your food, where you're like, okay, this is the amount of apple I'll have today, and I'll have this many good sugars, and this is something that will be beneficial for my body. You enjoy it more. So focus on that, especially if you're young. If you're older, you're not able to chew some vegetable, and if you're having issues, dietary issues, then okay, it's something that you can do. Okay, you fine, you can have vitamins, and you can have some other supplements.
It definitely is a last resort process, and
It should be, it should be.
yeah. So since we were talking about diabetes, how do you help diabetic patients?
Diabetes is something where we are supposed to monitor the blood glucose levels, the amount of glucose that is being, digested in your body. That is, whenever you take a sample of the blood and the sugar is a certain amount. In diabetes, the insulin production is low. The blood sugars don't get, you know, digested easily. So we are supposed to monitor the patient through exercises. During exercises, so that the blood sugar don't drop, especially if the patient is on a medication. We have two types of patients that come in. One is on diet patient and one is on medication patients. The diabetic patients who come on diet, who are controlling their sugars through diet, we can focus more. We can easily contrast them with the medicated patients, because we'll be able to plan two different plans for them. Whenever we are supposed to, whenever we have physical activity, whenever we add exercises in any sort of plan in a daily life, automatically our body starts to dilute all the sugars that are in your body, because carbs are digested. So diabetic patients have a lot of help through that. That is why all the patients, all the doctors, the first thing whenever you're diagnosed with diabetes, the doctor would be like, okay, start walking, because that will increase your metabolic activity, that will increase your natural insulin in your body, that will prevent your sugar from getting higher. So you will need lesser medications for that. So if you are on a controlled diet control, you will be able to do physical activity with that, diet control with that, and you'll be able to sustain that diabetes longer. You will be able to be without medication or insulin longer. You will not need that medication for for diabetes.
Our next question here is, when I'm hungry, I feel pains in my chest. What may be the cause?
Whenever you're hungry for a longer period of time, there are digestive juices that are secreting in your stomach. For some patients, these if you don't have a meal on time, these juices will, they will start to get up. That's how you get heartburn. So having chest pain will be most probably associated with that. You are either experiencing heartburn because of, empty stomach, because those HCLs and those enzymes that are supposed to digest your fluid, they're not very comfortable when they start to get up to your throat. So that is what is going to be problematic. That is going to be the main reason for the pain, most probably. But you should consult a doctor. You should definitely go to a doctor and ask for a physical checkup.
So this will be our last question here, and it is sort of like a combined question. How do we healthily gain, reduce, or maintain our current weight using nutrition?
All depends on there are so many diets. We have calorie based diet, we have carbohydrates based diet, we have no sugar diet, we have low sugar diet, we have a high protein diet, we have keto diet, we have so many sort of diets uh, that are, specific to particular thing. You want to gain weight, you will go to this diet. You want to lose weight, you will go to this diet. So you can opt for any of these options and include just physical activity, which will be just, walking or running, or going on a bicycle ride, any of these things, and you combine it with your diet. Depending on what you need, you'll be able to get the results you want. It's just particular to what you are desiring at that moment. If you have gained weight, you can go on a keto diet to lose that. If you want to gain weight, you can go on a high fat, high fiber diet by consulting a nutritionist. So you'll be able to gain that weight. This is how it works.
Thank you so much for this lovely presentation. Do you have any last words to the audience and students of physical therapy?
Sure. I would like all of the audience member, whether they are a PD doctors, whether they are just normal audience, focus on physical activity and make sure you're putting good things inside your body. We all are aware what is good for us, what is bad for us. We know that whenever we pick up a hunk of cheese, we know that it's going to go into our body and it is going to damage us. Just be aware of what you're doing to yourself. Just be aware what you're putting inside you, so that whenever the consequences come, you're aware that okay, this is what I've bought on myself. And physical activity is never bad. Always prefer action over anything else. So before going into any supplements or pharmacological interventions, just go for a little bit of physical activity. Start with minor exercising and go for that high. You will be able to see and feel the difference.
Thank you so much again for this amazing presentation. I think physical
You're most
therapy
welcome.
is such an important job, and we should definitely be encouraging our youth to come and take up sorts of jobs like these. Thank you so much to the audience for listening and engaging, and I really do hope you enjoyed it. And I'm seeing the feedback. The feedback is amazing. So if you need any more details, please visit our website, www.spunkgo.com. Thank you so much, everyone, and have a great day.